Welcome to Ulosca channel. Access all nursing practice questions. Health Assessment Denver School of Nursing Practice questions with answers.
Question 1. A patient reports shortness of breath when walking short distances. Which assessment finding supports this complaint? A. Pulse oximetry reading of 99%. B. Respiratory rate of 28 breaths min. C. Heart rate of 72 BPM. D. Clear breath sounds bilaterally. Which one is the correct answer? The correct answer is B. Respiratory rate of 28 breaths min. Explanation. A high respiratory rate indicates the body is compensating for lack of oxygen, supporting the complaint of dyspnea. Pulse oximetry may remain normal early in respiratory distress. Question 2. During a skin assessment, which finding requires immediate intervention? A. Mole with asymmetrical borders. B. Patch of dry, scaly skin. C. Skin turgor less than 2 seconds. D. Warm and dry skin. Which one is the correct answer? The correct answer is A. Mole with asymmetrical borders. Explanation. Asymmetrical borders on a mole can indicate melanoma, a type of skin cancer. This is a red flag requiring urgent follow-up. Question 3. Which technique is best used to assess for fluid in the abdomen? A. Percussio. B. Auscultation. C. Inspection. D. Palpation. Which one is the correct answer? The correct answer is A. Percussion. Explanation. Percussion helps detect shifting dullness, which is a key sign of ascites. Other techniques may support the diagnosis but are not definitive. Question 4. When assessing the carotid arteries, which action should the nurse take? A. Palpate both carotid arteries at the same time. B. Use the bell of the stethoscope. C. Ask the patient to take deep breaths during auscultation. D. Use firm pressure with fingertips. Which one is the correct answer? The correct answer is B. Use the bell of the stethoscope. Explanation. The bell is used to detect low-pitched sounds like bruits. Palpating both arteries simultaneously can reduce blood flow to the brain and should be avoided. Question 5. What is the most appropriate position for auscultating heart sounds? A. Supine with arms overhead. B. Left lateral recumbent. C. Prone with a pillow under abdomen. D. Sitting cross-legged. Which one is the correct answer? The correct answer is B. Left lateral recumbent. Explanation. The left lateral recumbent position brings the heart closer to the chest wall, especially helpful for hearing low-pitched sounds like S3 and S4. Question 6. The nurse notes a client's pupils are unequal in size. What should the nurse do next? A. Document as a normal finding. B. Notify the healthcare provider immediately. C. Ask the client if they wear contact lenses. D. Measure blood glucose levels. Which one is the correct answer? The correct answer is B. Notify the healthcare provider immediately. Explanation. Unequal pupils can indicate serious neurologic issues like increased intracranial pressure or nerve damage. Immediate evaluation is warranted. Question 7. Which cranial nerve is tested when asking a patient to smile or frown? A. Cranial nerve V. B. Cranial nerve 7. C. Cranial nerve 9. D. Cranial nerve 12. Which one is the correct answer? The correct answer is B. Cranial nerve 7. Explanation. The facial nerve controls muscles for facial expressions. Smiling and frowning assess its motor function. Question 8. Which assessment finding is most indicative of dehydration in an elderly patient? A. Wrinkled skin. B. Dry mouth. C. Poor skin turgor on the hand. D. Confusion. Which one is the correct answer? The correct answer is D. Confusion. Explanation. To avoid altering bowel sounds, auscultation should follow inspection and precede palpation or percussion. This preserves accuracy. Question 9. What is the correct sequence for performing an abdominal assessment? A. Palpation, percussion, auscultation, inspection. B. Inspection, percussion, palpation, auscultation. C. Inspection, auscultation, percussion, palpation. D. Auscultation, inspection, palpation, percussion. Which one is the correct answer? The correct answer is C. Inspection, auscultation, percussion, palpation. Explanation. To avoid altering bowel sounds, auscultation should follow inspection and precede palpation or percussion. This preserves accuracy. Question 10. A nurse auscultates crackles in the lower lobes of a patient's lungs. What is the next appropriate action? A. Have the patient cough and listen again. B. Document and move to the next assessment. C. Increase oxygen flow rate. D. Instruct the patient to take rapid, shallow breaths. Which one is the correct answer? The correct answer is A. Have the patient cough and listen again. Explanation. Crackles may be due to fluid or secretions. Asking the patient to cough helps determine if the sounds are transient or indicative of deeper pathology.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.